my name's Hannah. I'm a first year. Did I say that? I'm sorry. I chose Tufts because it was the only school where I felt like when I came in, I was welcomed by students and faculty. They put a big emphasis on diversity, and I just felt like they incorporated that in even an interview day. I felt seen. I felt like they gave me the autonomy to, or I felt like they had opportunity for me that really emphasized autonomy and allowing me to grow into a person and also a professional.
Hi everyone, my name is Leah and I'm a first year at Tufts Dental. Okay, so I first found out about Tufts through Dr. Holloway. She founded IDID, which stands for Increasing Diversity in Dentistry, and I just feel like Tufts is really family oriented and very supportive with the community. I also really like how they're focused on mental health, and Dr. Paston is a really great professor for that with yoga and just calming my nerves, everything like that. I just really appreciate how Tufts is.
Operative is fun. It's a little intimidating because it's the first time you're holding a drill, and it's funny because you want to go in thinking like, oh, I'm going to be really great at this at first, but you're not, and no one really is. So it's fun when you guys are all walking around together, struggling, but also it's enlightening because you're going through it together. So it's a good experience to bond with your classmates too.
So with Operative, as soon as COVID was kind of dying down and we were able to be in person, we were able to come right away, and we started having it once a week, at least once a week. And I think with Operative, I feel like even though it's something completely different, it is, to me, it's kind of like a break from studying all the time with exams constantly. So it is a challenge and everything is new for me, but I do like it because it's kind of like a break.
I love the fact that Boston is very walkable, so you can literally go from like eating Italian food and desserts in North End, and then like viewing the beauty of the architecture in South End, and then also just walking around Copley, Back Bay. I think that there's a lot to do here, and so you never really get bored.
Hi, I'm Mackenzie, and I'm a second year at Tufts. So a brief overview of what we're taking here at Tufts during our second year is a lot of more dental-focused courses, which includes endodontics, implant, a lot of fixed pros, removable pros, and of course everything else that's clinical related to get us ready for our third year in clinic.
Hi, my name is Andy Tran and I'm a second year dental student from Seattle, Washington. So my personal way of balancing the didactics with my lab requirements is I like to create a cushion for myself. I like to try to get everything done ahead of time. When I'm at home, I like to use this as my safe space to rest and relax. So when I go to school, I want to make sure that I get as much done as I can. And then that way when I get home, I kind of can relax and reset for the next day.
Hi, I'm Leora and I'm a second year dental student at Tufts. So second year has a lot of lab work and coursework, a lot more than first year. So I balance this by making sure that in my free time that I do things that I love, things that make me happy. I try not to think about school in my free time. So I've recently just taken up reading for fun. I used to do that when I was younger, and so I love that I'm able to get back to that. Another thing is I try and be creative as well. So I do my YouTube channel. I also like to meet up with friends and just have good hangouts.
How I balance didactic and lab requirements is honestly just pacing myself and utilizing just time management skills, whether that be just setting a schedule for myself or scheduling just time that I can have with friends that are also in lab so we can get things done in a certain amount of time, and honestly just relaxing when I need to know I need to relax.
Tufts is addressing racial inequality by giving us a safe space as students to really be vulnerable with each other and to talk about our feelings, everything that we've been going through outside of school, to really break down the walls that we naturally tend to build up as students going through a hard time.
We've recently had Dr. Holloway appointed as our Dean of Diversity and Inclusion, so I have been so glad that she got this position because she's been able to enforce this class of diversity and inclusion so that as a class we can understand each other more and learn about other people's struggles and kind of get outside of our bubble. And I really appreciate that because I think it's so easy to just kind of only know your own point of view and like what you experience. So I really appreciate learning from my classmates and hearing their stories.
So how much time do I spend in clinic? I can go in as often as I want, as little as I want, but I tend to go in about once a week. And the things that they teach you in clinic is they kind of just teach you how to navigate Axiom, which is the program that we use for our patient database. They teach us how to speak with patients. They kind of teach you everything that you need to know before you take on your first patient.
So how I feel about entering clinic, to be honest, I am nervous, but I'm definitely excited. It's a dream that a lot of us have been waiting for years on years. So to have this opportunity to treat patients and experience just that hard work that we're putting in, it's definitely going to be a rewarding but challenging experience.
So how do I feel about entering clinic? Honestly, I am really scared and excited at the same time. I know that I'm going to have a lot of responsibility. In just a few short months, I'm going to have my first patient. But I feel very safe in the fact that I have a lot of faculty there to make up for my mistakes. I have a lot of peers around me to support me. I have a lot of support as I go through this together.
Hi, my name is Diego Lopez and I'm a third year at Tufts Dental School. The transition into clinic, admittedly, it's pretty nerve-wracking at first. You're always so stressed out about your first patient because you've never done it before, you've never done it on your own before, but once you get in that chair and the preparation starts to kick in and you see how great it is to interact with the patients, then it's just such an amazing experience. It fills you with energy and it's wonderful.
Hi, I'm Jess. I'm a third year at Tufts. The transition into clinic after your first and second year, where you're mainly didactic and lab work, can be a little intimidating at first, but as soon as you get your first patient and you start settling into how clinics run, you realize all of those skills you learned first and second year are perfectly applying to your situation now, and your transition becomes easier without even realizing it.
My first patient experience was good, luckily. It went relatively smoothly. Whenever I would have hiccups, the practice coordinators would be there to help me out. Getting the consults, at first it was a little difficult to navigate, but working with prosthodontic specialists, periodontic specialists, it was all really, really great, and it helped me create a more effective treatment plan for the patient.
Tufts also does sporadic competencies for each subject. So they'll have an ortho competency, an oral path competency, where you have to review the information again and answer some questions in an exam format, just to keep you fresh and up to date with the information.
Oh, the VIP program, it's how does it not help me in clinic? It helps me for scheduling patients more efficiently. It helps me for increasing not only my accuracy, but my speed in clinic. In fact, right after we're done filming this, I'm gonna go work with my big in laboratory for a patient that I have coming up in a few weeks. So I'm constantly talking to my big, and I'm constantly trying to help out my little and help him whenever he needs to come in and assist. So the VIP program, it's of paramount importance whenever I get into the clinic.
The VIP program was my saving grace in clinic. It helped throughout my first and second year as well, learning things in lab and getting through exams and quizzes. But really, when you start in clinic, having a big and somebody that you can turn to when you're doing a first for a procedure, even though we don't like to admit that we have first, but we do. Having to go in for your first filling and having your big there who you know and you're comfortable with and who's done that procedure before, they can assist you and help walk you through it and keep you calm, show you how clinics run, where you get things, who to talk to. It's really great to have that person guiding you throughout, and to have a little who you can start showing things to as well. The VIP program is a family that they set up for you at Tufts as soon as you start. So as a first year, you'll have a second year big, and then you'll have a third year big and a fourth year big, or grand bigs. So you have somebody that you can always ask questions to, you have their contact information, you get to know them, you can ask them, how did you prepare for this exam? How do you handle these projects in lab? And then more importantly, when you get to clinic, you can ask them to help assist you, to help show you around. And then as you progress each year, then you have a little and a grand little, and you start helping to guide them through the years as well.
The externship program works where you go out into the world. You go out and learn dentistry at a real pace under supervision, of course. And you get to work in different communities with different demographics that you may not necessarily be accustomed to, and I think that that is a priceless experience.
The externship program is really cool because it gives you an opportunity to go out into the real world and work as a dentist at the real world pace. So here you'll have a 3-hour appointment for a filling. Out in the real world it'll be much shorter than that. You get to go out into community health centers. So you're giving back to the community and you're working in important areas that are very busy, and you get to do procedures in real time, in real offices, get to see some new technologies, get to see different materials that they're using and learn from them at a faster pace.
Your course load in 3rd and 4th year is awesome because it's not a lot of coursework. I've never really been a class type of person, so I love that we don't have to do that much classwork in 3rd and 4th year. You really get to focus on what you've learned and what you've worked so hard for 1st and 2nd year and apply it in clinical situations.
Tufts does a great job promoting interprofessionalism. For starters, we work with the nutrition school, mainly with our patients through our Canberra program. So we talk to our patients about their nutrition, and we collaborate with the nutrition school to discuss with them on dental care and dental hygiene. Also, interdisciplinary speaking, we work with all of the post-grad programs. So we work with prosthodontics and ortho and endodontics by doing consults with them on our patients and referring them when we need to, and also discussing with them when it's time to refer, when it's something that you can handle in the undergrad clinic. And these programs, since we have almost every specialty in the building at Tufts, they can come right to you and meet you at your patient. The oral medicine clinic can come and treat your patients for TMD, or oral path can come and look at patients' lesions that they have in their mouths. Or you can also call upstairs and go with your patients up to those clinics as well.